Okay. Okay, good evening. I now call this meeting on the Standing Committee on Accountability and Oversight to order. My name is Steve Norn, and I'm the MLA for Tunida Willida, and also the chair of the committee. Today, members of the committee are joining us in person, by phone, and by video while they continue to physically distance to help reduce the spread of COVID-19. I would also like to welcome our viewers who have also joined us here this evening. Tonight's meeting is being broadcast and live streamed. Committee will be hearing from the Honourable Cochrane, the Premier, Honourable Julie Green, Minister of Health and Social Services, and Dr. Kandola, Chief Public Health Officer, about the lifting of public health restrictions. And our first order of business is to open our meeting with a prayer, and I'll ask MLA Marcellos to offer the prayer. MLA Marcellos.
Creator, guide us tonight in making the right decisions for the people of the Northwest Territories. Bless all the MLAs that are going to take part tonight, and especially those that are from Cabinet that are here tonight. I want to ensure that we all make a right decision and have come here with open hearts, open minds, and with the prayers from the Creator so that they guide us in the right direction. Amen.
Okay, Masicho Marcellos. And going to your agenda, our first item here is the review and adoption of the agenda. And there's one item on the agenda, and can I have a motion to approve the agenda as presented? MLA Simpson. And we have no other changes to the agenda, so I have a motion to approve the agenda as amended. It's not amended. Excuse me, sorry. Give me a minute. And MLA Simpson has moved the adoption of the agenda. The motion is in order. All those in favor? No opposed? Motion is carried. And having reviewed and adopted the agenda, are there any declarations of conflict of interest? We'll do that as and when. And we'll move on to our first public matter. And with that, good evening, Premier Cochrane. Before you begin your opening remarks, I would just like to discuss how the meeting will proceed. All comments, questions, or remarks will need to be directed to me, the Chair, and both members and witnesses will need to be recognized by the Chair before speaking. This process is required to allow the committee clerk to turn on and off the people's microphones. And with that, Madam Premier, the line is yours.
Thank you, Mr. Chair, and thank you, members of the committee, for the opportunity to speak today on the GNWT's response to COVID-19. I'm joined here today by the Minister of Health and Social Services, Ms. Julie Green, Minister of Finance, Carolyn Wozniak, who is on hand to respond to any questions that may arise specific to finance, the Chief Public Health Officer, Dr. Kandola, and Sarah Cook, our Territorial Medical Director for the NWT. In addition, we also have the following officials in attendance. Mr. Martin Goldney, the Secretary to Cabinet, Mira Dunn, Ministerial Special Advisor to the Premier, Susan Laramie, Ministerial Special Advisor to Minister Green, Sandy Kalgutkar, Deputy Minister of Finance, Bruce Cooper, Deputy Minister of Health and Social Services, and Russell Nordoff, the Associate Deputy Minister for COVID-19 Coordinating Secretariat. Mr. Chair, our territory began preparing in February for the inevitable arrival of COVID-19 in our country and our territory. We quickly established committees to coordinate pandemic response activities across the government, began looking carefully at our supplies, and got ready to test and respond to cases should they arrive. As the seriousness of this situation grew, we acted quickly and tasked our public service with informing and protecting the public, as well as providing necessary services and supports that have kept our residents safe. That hard work has paid off. Our health system was not overwhelmed, as we saw in other jurisdictions. Our communities haven't experienced the loss of life as a result of this virus, and our biggest risks are being well managed. While acknowledging our successes, it's also essential, however, that we remain diligent and always look for opportunities to do better, so our response is as effective and efficient as possible. Feedback on our activities so far have highlighted the need for better enforcement, increased communications that are more coordinated, and being more responsive to individuals and businesses. The COVID-19 Secretariat is all about supporting a dedicated team, implementing sustainable solutions, providing better services to residents and businesses, and leading a strong, sustainable response to COVID-19. I want to be very clear when I say we're not starting from scratch. You will hear today, we are not proposing a whole new entity, but rather taking the pieces that used to sit in several departments and bringing them together. The incremental cost is very small, as we are moving existing pieces, not creating something entirely new. There are a few reasons why establishing a dedicated team focused on COVID-19 operations in support of this response is necessary. The first, Mr. Chair, is to support the services we need to maintain the protections we have in place. Services like Protect NWT, 811, isolation centers, and enforcement are necessary to protect and inform residents and businesses and to support our Chief Public Health Officer. These all exist now and would transition to the Secretariat. We know residents want these services too, and they want them to work well. We've heard from our stakeholders and identified areas where we could do better. The Secretariat will include the resources required to make those improvements so families and businesses can get the information and support they need as quickly as possible. I want to be clear that the COVID Secretariat costs are overwhelmingly costs we are already incurring, including Protect NWT and isolation centers. Prior to establishing the Secretariat, there were 163 positions working on our response to the pandemic. Bringing these positions together has already improved efficiencies and reduced the number of positions needed from 163 to 150. Of those 150, 86 positions are currently filled. 48 are current redeployments that will be converted to transfer assignments, 36 are casual hires, and 2 are terms. There are also staffing actions currently in process, including term competitions that have either closed or currently open for application or will be posted shortly. The public is being encouraged to apply to the casual pool, which is being reviewed regularly for applicants who may be qualified for the various positions and expressions of interest for GNWT employees who are also being used to attract interested individuals. Overall, establishing a workforce solely focused on COVID response activities will mean a more nimble, knowledgeable, and stable organization. Based on the cost to provide protections and services in response to COVID-19 up to July 31st, we are able to estimate that the ongoing cost for the same level of protection to the end of March 31st, 2021, under the organized structure of the Secretariat, would be $31.7 million. Of that amount, only $2.7 million is specifically associated to the new coordinating functioning of the Secretariat. That investment is what will allow us to pull together under one structure, find efficiencies, and ultimately improve our responsiveness. The GNWT's priority is working with the federal government to ensure we are able to maximize the amount of money that will go towards our pandemic efforts. A portion of the funding provided by the federal government will go towards the Secretariat functions, while the remainder will go towards healthcare system costs. We continue to work with Canada on a second funding stream to close the gap and ensure as much of a savings to the GNWT as possible. As we pull together under one structure, we'll be able to find efficiencies, control costs, save money, and make this a better deal for taxpayers while improving the service delivery. One of the priorities for the Secretariat will be reviewing and enhancing Protect NWT to improve information and services provided to residents. The Secretariat will also establish an evaluation framework to ensure we have better accountability and oversight of our COVID response operations. Mr. Chair, we need to get back to full strength on regular business in this government and meeting our mandate commitments. People and businesses are counting on us, as they should. There's no doubt that as COVID arrived, there were some who weren't getting the service they needed, while resources were redeployed to support the pandemic response effort. Building a dedicated body for our COVID response will protect the delivery of as many of our other programs and services as possible, no matter how the pandemic unfolds. As we work to realize these benefits, our government will be diligent, proactive, and transparent. Thank you again, Mr. Chair, for the opportunity to meet with the committee today. With that, I'll put it back to the chair to turn the speech over to Minister Green for her opening remarks. Thank you, Mr. Chair.
Masicho, Madam Premier. We will now hear from Minister Green. Minister Green, the line is yours.
Yeah, thank you very much, and good evening, colleagues. I appreciate the opportunity to update you on our health system response to the COVID-19 pandemic. As we move towards fall, we are prepared for more cases of COVID-19. We have measures in place to ensure that our health and social services authorities can respond effectively. The health authorities have a strong pandemic response plan in place. This plan is a comprehensive guide to how cases will be managed in our communities while maintaining the regular services that everyone needs to stay healthy. The first wave of COVID-19 has enabled us to accelerate change. Service improvements, such as virtual care, have allowed us to access both medical care and mental health supports. It has reduced wait times and supported individuals to access care at home if they wish. We continue to work hard to provide supports for our most vulnerable residents as winter approaches. We have engaged communities to establish safe isolation spaces for street-involved individuals at higher risk of COVID-19. For our elders and seniors, particularly those in long-term care, we continue to review and assess the public health measures necessary to prevent the spread of COVID-19. We understand the impact of COVID on the well-being of seniors, and we are committed to doing everything we can to minimize the negative impacts of COVID restrictions. In April, the Emerging Wisely Plan was released. This plan outlined the phased approach we would take to reopen our communities. Since that time, the Office of the Chief Public Health Officer has worked with businesses, schools, community organizations, sports organizations, faith groups, and others to accelerate most activities into Phase 2. We are committed to review the Emerging Wisely Plan in the coming weeks to adjust and update it as necessary. Public health orders have advanced the Emerging Wisely Plan and established a solid health system response. The travel restrictions and self-isolation requirements have effectively limited our exposure to COVID-19 and kept our communities safe. This has been a challenging time for individuals, families, communities, and businesses. I know our residents are looking for more change and more hope. We understand that. I have confidence in the gradual, evidence-based path our territory has followed so far. Dr. Kandola has been reviewing the most current trends across the country and the world and how that evidence informs how we move into the future while keeping communities safe and our health system strong. With that, I would like to invite through you, Mr. Chair, Dr. Kandola to give some remarks about our continuing response. Thank you.
Masicho, Minister Green. We will now hear from Dr. Kandola. Dr. Kandola, the line is yours.
Thank you, Minister, and thank you, everyone. Good evening. Throughout our public health response, we've based our decisions on evidence. And it's with that evidence we have worked to get more activities going into our communities. Because of ongoing collaboration and healthy back and forth and how to change standard practices to keep each other safe, we have moved almost all of these activities into phase 2 and expanded capacity for businesses and organizations across the territory. Call it 2.5, phase 2.5 if you like. This does not signal an incorrect approach at the start. This instead reflects a willingness for public health officials to work with our communities to bring the vitality back. It reflects rapidly evolving evidence on this new virus. And it reflects the spirit of openness and flexibility inherent in our approach. We were able to do this because we successfully pushed COVID-19 back. We did that with a robust early response to this pandemic, which took an evidence-based approach that considered our limitations as a territory. As we move forward, we continue to look at ways to open things up. We want to see more visiting. We want to see more businesses with greater capacity. And we want to bring everything a little closer to normal while still facing down this pandemic. But there are some steps along this path we need to hit before we can look at broad easing of restrictions across our territory. And I would like to lay them out. First, we need mass surveillance, so we can have a good idea of whether COVID-19 is present and how it is moving through our communities. This is reflected in the wastewater testing program we are ramping up now. This program will cover a greater share of population than any similar program in Canada. This means we will allow signaling of the presence of the COVID-19 virus in a population covering 50% of NWT without running anywhere near the 22,000 tests required on an individual level. It will allow strategic targeting advice to the affected community. The next is reaching full capacity in territory rapid testing for all symptomatic people. We expect to be there in October. Our health authorities have hired the right people. They are validating the new devices, and we believe we have a strong, stable supply chain. Residents will already have noticed a difference as we took the first step in rapid testing implementation. Our pending tests have been cut in half, and our turnaround times have improved considerably. This means kids are getting back to school and parents are getting back to work much sooner. Third, we will need to set up a targeted screening program, which will seek to mitigate key risks as much as possible. This would include asymptomatic testing of certain people at strategic intervals. There's still work to do on getting to this point, both on building in-territory capacity and deciding what is realistic to achieve with this capacity. And fourth, we need to continue building our contact tracing capacity, which public health has been steadily increasing throughout this pandemic. We are providing direction to the health authorities to establish positions specific to communicable diseases that will assist with contact tracing logistics across our communities. We've also met with national contact tracing resources, such as Stats Canada, to identify surge capacity options for contact notifications. As we take these steps, we'll be in a strong position to consider the kind of changes we know people are looking for. By getting rapid testing in place, we will be able to identify cases, give advice, trace contacts quickly, and get kids back to school and parents back to work sooner. With targeted screening, we can explore ways to mitigate risk associated with travel, give our communities the comfort they need to know they're safe, and look at the safest ways to reduce our isolation periods. With mass surveillance through wastewater, we'll have a better idea than anywhere in Canada how COVID-19 is moving through our communities and be able to respond more quickly than diagnostic testing. And with expanded contact tracing, we will have the resources to respond and contain outbreaks. I am confident we'll make these strides, but it's going to take a lot of upfront work. For now, we're asking residents to be patient and stick with us. We know this has been hard, but we must remember that these efforts made by everyone in our territory to rise to this challenge has paid off and will pay off in the future. We are now in a position to look at moving forward to easing restrictions while other provinces are beginning to fall back. That is possible because we all came together in ways we have not before to take strong collective early action to push back this virus. I can assure everyone we are investing in the staff and equipment we need to get this done. And we are developing models to inform decisions on public health measures. My team will continue to work around the clock across our health system to maintain a durable evidence-based response and to build our territory's resilience as we face down this pandemic. And we will do it not for us, but for the health, the well-being, and freedom of all our residents in the Northwest Territories. Thank you.
Let's show Dr. Kandola. And thank you for that. I just had a question from one of the members. Yes, we're going to do one round of questions and with one follow-up. And we have a predetermined list, and I have first up on my list for questions is Emily Cleveland. Emily Cleveland. Fine.
Thank you very much, Mr. Chair, and thank you very much, everyone, for the presentation and for your time this evening. I want to start off by saying that I am thankful for how the initial swift response was handled by the Chief Public Health Officer to ensure that we didn't end up with community spread in the Northwest Territories. And I think it's important to note, based on the feedback that I've received from my constituents, that we do not currently have community spread or any cases of COVID in the Northwest Territories. Luckily, we haven't lost a single Northerner to COVID in the Northwest Territories, but the concern that I'm hearing from constituents is we have lost Northerners to things like suicide, illness, addictions, and interpartner violence this year. At the beginning of the 19th Assembly, Cabinet identified $25 million for our 22 priorities that would change the lives of Northerners. And the COVID Secretariat now has $86 million in order to deal with the response of COVID-19. And I know that this is a pandemic, and yes, safety is paramount, but what I'm hearing from constituents is they're wondering if the GNWT has a little bit of COVID tunnel vision right now. Constituents are also really concerned in my riding about consistency of policy foundations. Here in Yellowknife, we can have, go out to a restaurant with people and sit and eat dinner, but those same people can't put on a mask and sit 6 feet apart while watching children's activities. And so there's a little bit of frustration there. And so what I would like to know, I guess, is based on, the differerences in the spending and then the differences in the public policy and the inconsistent policy foundations, where are we going, and is this actually a sustainable response for us? And I know that the way that we're spending with COVID-19 right now, based on the fiscal situation of the GNWT, it doesn't feel to the people of the Northwest Territories that this is going to be a sustainable response. And so I guess my question is, how long would it be based on this response that we would take to hit our federal borrowing limit, and also what other responses were considered, given that businesses and municipalities had to pivot in order to handle how they were responding to COVID-19? Thank you.
Merci to Emily Cleveland. With that, I'll direct that question. Do you want to take that question, Minister Green?
I'm going to direct that question to the Premier. Thank you.
Okay. Merci to Madam Premier.
Thank you, Mr. Chair. I'll begin, and then if the Chair allows, then I'd like perhaps Minister Wasnick to have a say in this as well. So absolutely, I hear that people are worried about the difference between what we spend on COVID-19, our protective measures, versus the mandate monies. And when we started here, we didn't expect a pandemic, and then we got hit into it. Every jurisdiction throughout Canada, every country in the world is facing this at this point. So we're not alone in this endeavor. Every jurisdiction is spending money that they didn't count on. So I do want to point out, though, that this money, again, is not just about starting the Secretariat. The coordination of this whole thing is only $2.7 million in this fiscal term. The majority of the money is, almost half of it is going to our isolation centers. If we don't have the isolation centers, then we have discrepancies between access to people in the smaller communities. It's easier for people in our bigger regional centers to have homes, etc., because of the healthcare facilities. That's not so easy in the smaller communities, and so we can't penalize them. Our isolation costs are costing us around $14.6 million we're looking at in this fiscal year. Our second largest cost is our border compliance, almost $4 million all total right now. Very much needed. In fact, Indigenous and municipal governments are asking for more. So on that, we're hoping to hire locally to get jobs in the communities, but it's, again, very needed. Protect NWT is our third largest cost. And actually, the business community, the residents are saying we need more investment in that because of timeliness, and we recognize that. And then our regional compliance is the fourth largest cost in this structure, and it supports community-based positions where, again, we're trying to hire community residents. So, Mr. Chair, I think that what I'm saying is that most of these costs are fixed. They're necessary no matter what structure we do within this COVID Secretariat or not. At the beginning, we redeployed a whole bunch of staff, and even then we had to hire people to supplement it. Over time, we realized we needed more. I mean, like I said, people were crying for, give us a place that we can contact. So we did A11 and we did Protect NWT. We need more solutions to keep our residents safe. So before I turn it over, Mr. Chair, to Minister Wozniak, if you will allow, I would like to say that, again, it's $2.7 million for this fiscal year to coordinate all these services, which will give us more coordination, better management, and better oversight of what we're doing to address this health and safety in the pandemic. And but we're willing to work with committee. It's not about one-sided. So I am open to any kind of recommendations that committee will give to us so that we can actually provide better services to the residents. Thank you, Mr. Chair, and if allowed, I'd like to turn it over to Minister Wozniak.
Yes, Madam Premier. Minister Wozniak, line is yours.
Thank you, Mr. Chair. Mr. Chair, it seems like a long time ago now to think back to delivering Budget 2020 in February when the conditions we were all living in were quite different. But, I just wanted to take a second to remind you and remind the members that back at that time, we were at that point already projecting to be approaching by the end of this assembly at or near our then borrowing limit of $1.3 billion. So I say that to sort of temper the next part of what I'm going to say, which is that we are in much the same situation now, which is to say that our borrowing limit was increased to $1.8 billion. And if all the current modeling and projections remain unchanged, we are again, or still, projected to be at or near that borrowing limit by around the time of the end of this assembly. But that's still, fortunately, some years away. And that's exactly why we do the modeling that we do. That's why rather than just looking at what have we spent so far on COVID, we've done the work of taking that and extrapolating it to actually build in what it will look like if the current measures remain in place. And if, in fact, these current measures remain in place over the next 2.5 or so years into 2023. Because by modeling it, we are better able to plan and better able to see whether or not, in fact, this kind of a response is sustainable. This is I think this is not to delve into too much of what you're hearing from the Chief Public Health Officer in our health department, but this is meant to be a conservative estimate. It's meant to be an estimate that looks at the more aggressive measures, the measures that we put in place early on before we understood a lot of the different responses, before we had the evolution of our health system. I remain quite hopeful that we will be able, not only through the COVID Secretariat, to find efficiencies and streamlining, but also with the evolution of our response, be able to find better ways of addressing our response that doesn't require us to continue to invest as aggressively as we have. Thank you, Mr. Chair.
Mr. Minister Wozniak, follow up, Emily Cleveland.
Had one. Thank you. I put them both into one.
Okay. Up next, I have Emily Bonnerouge. Emily Bonnerouge, your line's yours.
Blessing, Mr. Chair. Can you hear me okay?
Yes, we can. Go ahead.
Okay. Yeah, thank you to the Premier and the Minister and the CPHO and the Finance Minister and the other staff that are with us this evening to discuss the COVID-19 Secretariat. I know we all realize that COVID-19 is a serious pandemic. Since its start back in March, I know the NWT and the staff have done very well in containing and putting actions in place to curtail, further incidents of the virus. I'm also feeling that I'm hearing a lot of NWT residents that are not in favor of setting up this huge secretariat that's taking up, some good valuable funds that could be used in other areas. I would rather we just stuck to the status quo of how we're operating, because it seems to be sufficient, as our territory doesn't have a single case of the virus. I think we're doing well. Maybe we could also tighten up at the border. We could also, we've been asking for extra staff to be able to man the emails and respond in a timely manner, and also for the phone calls. I think we've done very well. We could also always use the existing staff wherever we can and just deploy them to work on this. That's a lot of money that, the funding could be used to build more homes or apartments in the small communities. It alleviates homelessness and keeping people off the streets and couch surfing and keeping them safe. Also during the coronavirus, the pandemic we're having here. I know NWT Housing Corp has always stated since the pandemic that they had available units in the communities. I've never ever seen an available unit in my community. So this would help that initiative. I would also suggest that we provide, ventilation units to all the small communities' health centers for emergency purposes. That's being proactive in the small communities in case they can't get a medevac in there. This will also allow, the residents that travel out of the territory to self-isolate at home. If we have such a unit in place, this would help. It helps alleviate your enormous hotel costs. It's something to really think about, that initial cost. You can use that money to buy all those ventilations. This would really help. It'll help curb the cost for hotels and whatever else. Also, we took a survey of other jurisdictions. We had our staff looking at across Canada there. Even the large provinces that have the most virus cases, they don't even have a secretariat in place. They're just using, just like we are, the status quo, using what we have existing through the health department, and it's working. I don't know the real rationale for setting up something of this magnitude. Maybe you can help me, try to understand that. But I'm I'm the same as all the other residents. I'm just not in favor of this COVID secretariat because that's a huge expense. Seems like we're always playing with money every time we lift the debt ceiling. Now we're saying, oh, we got more money to play with. Let's be prudent with how we spend our money. Merci.
Thank you, Emily Bonrouge. I didn't hear a question there, so Madam Premier, you could respond to that if you'd like.
Thank you, Mr. Chair. I'll start by recognizing the appreciation for the staff. I appreciate that MLAs recognize and the public recognize the amount of work that staff has done. All of Cabinet is really proud of the work that the public service has provided to date. I heard that the status quo is sufficient. However, at the same time, I hear that we could do more about our border compliance and things like that. So again, I go back to the money that is actually for coordinating the Secretariat is only $2.7 million. That $2.7 million, Mr. Chair, is not going to pay for a lot of health services into the smaller communities. The other portion of that money for the $31 million is our isolation centers. It's our border compliance. It's our task force regional compliance, 811 and Protect NWT, and our PPE for schools, municipal and Indigenous governments. I recognize that the larger jurisdictions don't have a secretariat, Mr. Chair. Large jurisdictions also have a lot more funding than we do for services, and their money goes farther than ours in the north. And I would hopefully agree to disagree. I wouldn't say that it's working when over 1,000 people every day are now getting diagnosed with COVID-19 in the south. My understanding, Dr. Kandola can correct me if I'm wrong, we're in a worse, the second wave is probably going to be worse than the first wave, Mr. Chair. So I think we have to recognize that as well. Thank you, Mr. Chair.
Thank you, Madam Premier. Up next, I have Emily Johnson. Emily Johnson, the line's yours.
Thank you, Mr. Chair. I have a lot of questions, but I want to start with the way we're presently using our rapid testing. I have constituents who are on consistent medical travel, meaning every few weeks they have to go to Alberta. And then for half of their time or half of their remaining life, they got to spend it in self-isolation. I know the department is not willing to test people in order to shorten that isolation time, but when I look at the COVID Secretariat and see that half of the budget is isolation centers, and I recognize there's some risks with asymptomatic testing, but if we can't use our rapid testing to shorten people's isolation times, especially those who are spending the remaining years of their life, in a consistent state of self-isolation, I don't know why we even got rapid testing. So my question is, for whoever is in charge of the testing priority, can we get some system where rapid testing can be used to shorten isolation periods? Thank you, Mr. Chair.
Emily Johnson, Dr. Kandola, would you like to take that?
Thank you, Chair Norn. That's an excellent question. When we first started the first wave in March across Canada, what we had available, what we knew was that 14 days of self-isolation would protect you against the incubation period if you were exposed to COVID-19. In the Northwest Territories, it's only recently in the last several weeks that we've had the ability to do rapid testing. And the specifics around rapid testing, I will ask Dr. Sarah Cook to comment on that. What the rapid testing this current moment is aiming to test people who are symptomatic. So right now, we were getting a lot of complaints around the turnaround time to Alberta, and we are trying to ramp up just to deal with people who are symptomatic. What Emily Johnson is referring to, I would say, is targeted screening. The targeted screening is looking at people who have no symptoms and testing them. And I think that is a good approach, and it's one of the four pillars that I'm looking at is number third. So the first is about mass surveillance. The second is about rapid testing. would be targeted screening, and the fourth would be timely contact follow-up. These tools are new, and right now there is Health Canada is reviewing a point-of-care test, which is a rapid antigen test that allows a quick diagnosis, literally within minutes. And if we're going to be doing mass targeted screening, this would be a good tool to look at. But unfortunately, it's not licensed yet. When we have the ability, the means to screen high-risk people, those people who have traveled, we would definitely explore that option. And I do get the letters from people who are on med travel, and I hear their stories, and it is really, really difficult. I just as much as you want to move to a situation where we can shorten those isolation periods, but to shorten that isolation period, we need to have a quick, effective test that we could administer to at least 1,000 people. And right now, we don't have that, but we're working our way towards it. About ability to test people asymptomatic and the impact that has made on NWT, I will ask Chair Norn to refer that over to Dr. Cook.
Masicho, Dr. Kandola, Dr. Cook, line's yours.
Thank you, Mr. Chair. And thank you, Emily Rutland, for the question. I just want to acknowledge also just how difficult the situation is. I see it firsthand as a practicing clinician, particularly in cancer care, with patients who are having to travel to Alberta for some aspects of cancer care and then come back and be on isolation. So I understand it is a very challenging situation. I will speak to the impact of rapid testing, but I also just want to also speak a bit about the impact of virtual care and the importance of actually reducing unnecessary travel outside of the NWT. And this is a really important part of our response and an important change that we've made in the way that we function as a healthcare system. Of course, often it is important and necessary for patients to travel outside of the NWT for particular types of services that we don't provide here in the NWT. But for those services that don't actually require in-person assessment or laying on of hands outside of the NWT, we've really made a big effort with our partners in Alberta to switch to more virtual care. So we do have many specialists in Alberta who are now caring for our patients in the NWT through virtual care, which has also allowed people to stay in their home communities as well. In terms of rapid testing, there's been a significant change in the last week since we were able to implement the BioFire machine and validate it. It was validated as of September 18th, which means that we were able to start to release results much more quickly. So our mean turnaround time at this point is 19.88 hours. So that is from the time that the swab is collected to the time that the swab result is reported. There's an additional time from the time it's reported, of course, to having the result called. And we're working hard to make sure that we have enough staff to be able to call those results very quickly. But we know that that residents of the NWT have noticed a significant improvement in the turnaround time. In the last 15 days, since using the BioFire, there have been 551 tests that have been done rapidly in the NWT, so an average of about 37 per day. We currently have a capacity of 48 per day, and we're hoping to ramp up to a capacity of approximately 96 per day. And that's going to be dependent on the validation of the other new machine called the Simplexa machine, which is currently installed and going through a validation process right now.
Masicho, Dr. Cook. Follow-up question, Emily Johnson.
Thank you, Mr. Chair. I guess when I look at this 150 new positions, and I want to emphasize they are new positions because they didn't exist before COVID. I recognize we're pulling them out of some departments and some people are transferring over, but already departments are starting to backfill them. I also don't like this rhetoric that it's not new money. People, when they hear this, this is now becoming essentially a referendum on our total COVID response, and the rollout's been problematic, and I think that's unfortunate. But when I look at this SUP that will come over in October 15th, that targeted screening seems the key to me. If half of this cost is isolation centers, then let's cut down the isolation time. And I guess this leads me to another point. I'm not convinced that with 0 cases right now, we need every single person who's not in one of the hubs to be isolating in one of those isolation centers, and we need to be paying for their room and board. I've heard people from Tuck, I've heard people from Simpson who want to go home. It's our road access communities. They want to go home. They don't want to stay in the hotel. I recognize when this was initially implemented, it was a bit of a compromise because our small communities don't have the health resources. So can we look at spending that $15 million a different way and getting them the health resources? I guess the question coming out of that, is there any chance before the subs come forward that we're going to limit the need for the isolation hubs by allowing people to proceed to their home communities? Thank you, Mr. Chair.
Thank you, Emily Johnson. Madam Premier?
Thank you, Mr. Chair. Those are conversations that we're talking about now. Those are reasons that the Secretariat, those are things that we'd be looking at. I think that Dr. Kandola stated pretty clearly that there's conditions. If we can get the testing, the screening, the contact tracing, and the mass surveillance, then things can be put into place. That there might be some options with that. And as for opening up other communities, those are options. Those are great things that I'd like to hear from the MLAs. And the more feedback we can get on ways to save money in our isolation centers that are feasible, that don't penalize the poor, that don't penalize the small communities, then we're more than happy to hear it, because we recognize the costs too are extreme. But we have to make a choice between the health and safety of our residents, which to date have been paying off, or letting go of the isolation and the border patrols and all the things that have kept us safe to date. I don't know how many people haven't come that have COVID-19, and we could probably find out how many people we've turned away. But it is, again, I keep going back to this, the rates across Canada are increasing substantially. So now is not the time to back off, in my personal opinion. But again, I'm one member of this assembly, and I'm looking for solutions and options from the committee. Thank you, Mr. Chair.
Thank you, Madam Premier. Up next, I have Emily Semler. The floor is yours.
Thank you, Mr. Chair. I would like to talk a little bit about a lot of the things that have come forward to me from my constituents, because I'm here to bring their concerns forward and things that I've seen and things that I've witnessed. And I know in the beginning there was that panic, and we did take the measures in the beginning because we had no idea what this was. We never, what we were hearing was way worse. Death rates were higher, all of these things. And yes, maybe it's because we took such strong measures in Canada that we limited the amounts of what was happening. We were also, under the impression, and we pushed this, I pushed this, that we needed to, take these precautions because we were flattening the curve. We have no curve. We had never had a curve. We had 5 cases. Then we were told that we needed to ensure we didn't overload our healthcare system. Our healthcare system is probably being overloaded by the number of things that my colleague MLA Cleveland has mentioned. With the alcohol, we never stopped the alcohol. We limited, but it got worse. In the small communities, we've seen it, we heard it, especially with the COVID, the CERB, we've seen that go, increase the amount of drinking and stuff that was going on. But the one thing that, there's a few things. So I've heard from my region, and this is something that Yellowknife will never understand, is that connection with Yukon. They'll never understand that connection. Yukon is our lifeline. This is where we go from the Beaufort Delta, as everyone in the south and Yellowknife goes south on the highway. So I know I asked early on that before Yukon opened the border to BC, if they could give us a leeway so that we could get out to Yukon. It never happened before that time. I think that was 3 weeks before. It never happened. We were never given that bubble to be able to do that. Yukon has moved into phase 3. They've allowed BC in. They've had one case and a few cases that have been from outside. They're taking the measures that are, they're a little bit more lenient on the measures, but they haven't seen the numbers that, you know, if we were to, I don't know if that's any different. They have small communities like we do. They let their NWT residents now go home to their communities to isolate when they return back. If they can't, then that's when they put them in an isolation center. So, you know, I feel like that with all the work that they've been doing, I think they've been doing a great job, and I really feel like we need to relook at that bubble, you know, even if there's stipulations on it, but I feel like that bubble needs to be looked at like we have with the Nunavut. The other thing was, because some of my colleagues talked about some of the topics that I had, but another one that we've heard is this, it's almost like this double standard. We're in the Northwest Territories. We get the isolation plan. I left. I had to come by. I had to drive from Yellowknife to Northwest to Inuvik. So I had the 3-day travel through Alberta to Yukon, or to BC to Yukon and home. I had to isolate at home. But the rules that I got were, you know, stay at home, can't go in any public places, you know, self-distance. I couldn't live in the house with my daughter, so I had to live in the camper. You know, these are the things that we had to do. And, but then I go on committee meetings to Hay River, and I go to get an ice cream, and there's workers that are working on NWT infrastructure, and I ask them, of course me, I go and I ask them, why are you wearing a mask? And they said, oh, because we're out of province workers. So they're in the same store with me, but I'm told, and the rest of the NWT is told, we can't go in stores, we can't do this. Call caremongers and they'll get you your stuff. And then I'm in Inuvik, I'm going into my office, and all the workers that are out of province workers are going into the hotel where my office is, and I ask them, why are you wearing masks? Where you come from? You know, that's just me. Again, they're out of province workers. So there's this double standard where we're not allowed to go out, we're not allowed to go in public. If we wear masks, like these are some of the things I think need to start to loosen up, because people are, you know, if they're coming in and they're coming back to their community, and if they're wearing masks, and we should be given the same respect as you're giving the workers that are working on NWT infrastructure, GNWT infrastructure, the mines are the same. You know, I think these are things that we need to start to look at. We can't paint everybody and say, only Alberta residents are gonna listen, NWT residents aren't gonna listen. So that came as a real, and that just kind of leads me into the next thing. You know, I've over this period, I've mourned with a lot of my community members, and watching them have funerals and not allowed to have a daughter not allowed to bury her mother, you know, a father not allowed to be there for their son. You know, these are the things, and then to say, well, if they're from out of province and they come in and we give them the rules that you wear a mask and you stay in isolation and you come, and it's an outdoor funeral, because indoor funerals are not allowed according to the phase that we're in. So, but they are allowed to walk around if they get approval. You know, they can go for walks and self-distance from other people. So these are things that I think, one of the things that I think of is coming up wintertime. We're not allowed to have funerals, but there's been a lot of funerals in churches, and I've seen, you know, everybody sees them. People post them stream them on Facebook. So but no one's gotten sick, you know? So that's one of the issues that I think that we need to look at. And, you know, and I think the other thing is, you know, just having that cultural awareness on how people treat their loved ones. This is another thing that you have to take in account. Yes, we're working by evidence-based, but we have traditional evidence-based. We have, you know, and if I'm saying, if families of Indigenous people want to bury their loved one, and Dad, I mean, any one of you, if you had to bury your child, your in-laws, your parents, your husband, your wife, you would want to be there. What if you were told, go bury them, and then we'll come back in 2 weeks and we'll have a funeral after you're done your isolation. That is just not okay. We shouldn't be doing that. We should be giving them the rules that they need to have to be safe, allowing them to have their time to mourn and move on. You know, if they have to leave the next day, you know, they're coming in, and Yukon resident or Alberta residents are coming in on Canadian North, flying right into Inuvik every day, every time there's a flight. And we're all mingled together. So when I get on the plane and I go home, it's going to be half the plane is full of from Edmonton. And they mingle around with us in the airport when we're waiting for the next flight. You know, and in Edmonton or in Yellowknife, you don't even have to wear a mask in the airport. So who knows who just got off the plane from Edmonton and they're standing with you. These are some of the things that, I get it, I understand we need to make sure people are safe, but we also have to trust, you know, that people are given these types of things and that we're looking into them. So that way, you know, we're not just going, well, we did it this long for this way. And that's why we have second waves. That's the evidence that showed before when they had, is because people got tired of being locked up, got tired. And so we have to start to, you know, like Caitlin says, mandatory masks when you're in the public. You know, if that's something that you have to do, then maybe that's something that we have to do. But so I know that was a long rant, but I needed to get it all out, and I only get one question, and so that's what you get.
Yeah. Thank you, Emily Similar. We could start with Madam Premier.
Thank you, Mr. Chair. I think I'll turn that to Dr. Kandola if the Chair allows.
Thank you, Madam Premier. Dr. Kandola, line is yours.
Just wanted to thank MLA Semler. I hear her frustration. There's a lot of things that, because we'll have better tools. There are some changes we can make. The whole idea about targeted screening and impact on isolation periods, that's something we're modeling right now. What's stopping us from moving forward is that the type of test that we need that is quick, efficient, that we would have the capacity for, still has to be approved by Health Canada. We're waiting for that. The whole idea about mandatory masking, if we are going to be moving on providing more flexibility in where people isolate, we've done 20,000 self-isolation plans since this has been started. Of those 20,000, 30% were workers. And of the total self-isolation plans, about 15% were essential workers that started from day one. And they're supposed to follow the same rules. And if they are not off shift, supposed to be going to stores or into restaurants or not wearing masks. So if this type of information is seen, it needs to be presented to Protect Edmonton and investigated, because there are rules around the privilege of being able to be essential worker, and you need to self-isolate when you get home. They should be following rules that respect the health and safety of LGBT residents. And if that's not happening, we need to know. The whole idea about choice, about how people self-isolate, where they self-isolate. After 20,000 self-isolation plans, I hear you. People who can self-isolate outside of the hotels should be given that choice. And the third thing is, if we are going to going into the winter, going into a more indoor environment, we shouldn't be guessing who should wear a mask, who shouldn't. It's going to be a lot simpler, just like every other jurisdiction, is to look at mandatory masking. And that way everyone feels safe, and then you don't have to think, is this a worker who should be wearing a mask, or is this someone self-isolation wearing a mask? Everybody's wearing a mask. These are all issues that I'm going to take seriously and look into next several weeks and see how I can look at our current travel restrictions and self-isolation order and improve them with our new tools. We have new tools available. Just to let you know that rapid testing for symptomatic people, that's been a game changer. For prior to this, there were a lot of complaints about huge lag periods, up to 6-7 days on average. as long as 10 to 14 days. I'm not getting those complaints this week. There's issues around med travel, perpetual isolation. There's issues around people wanting to be with their loved ones. It's these type of stories that push me to find, like, how can we improve it? What do we have? What tools do we have available? And I'm very hopeful that we'll have tools and some amendments that will make life a lot easier for people, but at the same time keeping people safe. You have to understand there are 7 jurisdictions in Canada that have very stringent self-isolation and travel restrictions. And those are the 3 territories and the Atlantic bubble. And it's not by coincidence that those are the very jurisdictions that have negligible, zero, or very small number of cases coming in, that they are pretty much have flattened the curve. What is worrisome is that in some parts of Canada, they have started the second wave already. When you look at rates in Quebec, Ontario, when you look in Alberta and BC, the cases are going up. There's an upswing. This is literally the 3rd week of September. And so the trajectory that we are in Canada is not a trajectory to say we need to lift travel restrictions. Unfortunately, the travel restrictions are going to be in place to at least the end of December, while we're watching this trajectory increase across Canada. In the last 7 days alone, 5 out of the 7 days, we've had more than 1,000 cases per day. And what we know about COVID is it increases exponentially. So we don't know what the trajectory will be in a couple of weeks, but it has been modeled, and what the Chief Public Health Officer for Canada, Dr. Teresa Tam, says, if we do nothing and continue the same amount of contacts, we are going to have a surge. We are going to go into the second wave. If we, with all our public health restrictions and having our borders closed, try to clamp down and change the way we interface with other people, maybe we'll get back to that slow burn. But if it continues to rise, and if we don't do anything, then we're looking at a significant exponential increase. So this is unfortunately the world that is surrounding us right now. And so our goal is for NWTs, how do we allow as much freedom as possible within NWT, but not allow full lifting of measures, so that we will be no different from the rest of Canada in terms of how the cases are hitting us. And that's the fine line. Hearing stories from yourself, MLA Johnson, these are stories that we take seriously, and we do our best to respond to. The stories we were hearing before were around rapid testing, and we respond to that. There were stories around protecting BT, not responding, or the borders. And so we respond to what we hear from the public, but at the same time, we're in a pandemic, and it is not going away anytime soon. Thank you.
Mr. Chair, Dr. Kandola. Up next, I have Emily Jacobson. Oh, sorry, my apologies. A follow-up question for Emily Siller. Sorry.
I just to add, I know early on, Mr. Chair, we were working with the Premier and Dr. Kandola with a bubble with Yukon before they announced that they were going to open up to BC. And I'm just wondering if they are going to still keep that in mind with cases in BC going up, and if by chance that Yukon decides to shut their border to BC, would that be something that they would look into again especially for my region? And thank you, because for Dr. Kandola for saying she'll look into masking, especially for funerals, because it gets to very cold here in the Northwest Territories, and to bury our loved ones outside in an outdoor funeral at 50 below gusting winds is not acceptable. And if we can make precautions so that we could safely do these indoors over the winter so that this can happen, I would be very much appreciated. Thank you, Mr. Chair.
Thank you, Emily. Similar. Would you like to take that, Dr. Kandola?
I think Nunavut and MWT would love to bubble with Yukon, but not with BC. And so there has to be if Yukon has that open border with BC, starting to see an increase in cases, we can't take that risk. All the work we've done for travel restrictions would allow this kind of loophole to get within NWT. But if Yukon decides to reinstitute their mandatory 14-day self-isolation with BC and is open with NWT Nunavut, we'd be open. We'd be open with the Atlantic provinces if there was a way to do a direct charter with the Atlantic provinces. Right now, when we're looking across the board, we have the 4 Atlantic provinces. We have Nunavut, and Yukon is stable for now, but we will continue to watch Yukon as the cases in BC continue to rise. But that will be on the table in terms of a bubble with Yukon. Thank you.
Up next, I have Emily Jacobson. Emily Jacobson, line is yours.
And all your staff that are on the call. I just have a question. Mr. Johnson and Lisa brought it up a bit. It's rapid testing for my constituents in Nunavut. I have 4 communities that have to, if they're heading out for medical travel, they head out to Edmonton, and then they come back into Nunavut, have to isolate in Nunavut at the hotel for 14 days, then they get to go home. But then you get somebody from Nunavut or Norman Wells or somebody from one of these hub communities, get to do their checkup, come back in, you get to go home that same day. I know it's just like a double standard. For the Beaufort Delta, I'm asking under this COVID Secretariat for this rapid testing, what is the timeline to get this unit and being able to do rapid testing in Inuvik, right at the airport or right at the hospital, get you cleared and you get to go home? And that's instead of having to wait the 2 weeks and then only selected people are being rapid tested and not all. And I'd like to see that done as soon as possible, and no matter what the cost is, because you're saving money on the hotel room. And it's too tough on my constituents to having to do that. Especially like Lisa said, Lisa really said it well in regards to all the stuff that our region's been going through with all the deaths and everything. So I need to see what is the timeline on that, Madam Premier, and if it's possible.
Thank you, Emily Jacobson. Did you want to start, Madam Premier?
Thank you, Mr. Chair. I think this is a question for Dr. Kandola. Thank you, Mr. Chair.
Thank you. Dr. Kandola.
Just want to thank MLA Jacobson for his question. And so one of the, what we're using rapid testing right now is, and we're trying to ramp up, is for people presenting with symptoms. What MLA Jacobson is referring is targeted screening, is testing people who don't have symptoms as a way of looking at how we can change their isolation period. What is interesting is we have 7 jurisdictions that have very strict self-isolation orders, but other than Nunavut, I don't know any other jurisdiction that are forcing people to go through the regional hubs first and then onto the small communities. In the beginning, when we were looking at the first wave, we were watching what was happening in Italy and the US, initially China, and we were looking at the capacity, and we were trying to understand this virus more and more. And so the focus was to isolate people initially in the 4 regional hubs, and then move them onto the small communities, because that was where we had healthcare facilities. We've done 20,000 self-isolation plans, and I think we've learned a lot. We've also heard the stories of people who who are healthy and could have self-isolated into the small communities. We hear their stories. We're hearing from the MLAs. People need to have a choice, and we're taking notes. And I understand we have a lot of history, and we can move on that area. The one caveat I have with med travel patients is, when you're looking at healthy people, who are traveling for vacation, coming back, or traveling to visit relatives, coming back, and they're relatively healthy, and they don't have pre-existing conditions or complex health needs, or they're not seniors. Those type of people can safely isolate in small communities. They'll tend to have milder illness, from what we now know more and more. When you're looking at the med travel patients, they're not all the same, but if those are more complex or higher risk patients, it may be prudent to have some initial isolation in the isolation hubs, especially during the period when the first week or so, when they're more likely to become symptomatic, and then maybe look at targeted screening and be able to isolate the second week, maybe back in their small community. But I'm talking about a specific subset of complex med travel patients. Obviously, if you went to deal with follow-up of something that's not going to cause increased severity for COVID, if it was not a complex issue, those can be considered, and we can look at relooking at our orders around isolating the regional hubs. That has to be examined. It seems to be a consistent theme. But just realize that with med travel patients, there are going to be some that are higher risk, and we may want them just to stay a bit in town, stabilize, and then move on. So each case is different, but that's our rationale for the med travel.
Thank you, Dr. Kandola. With that, we're just going to take a quick 5-minute break here. It seems that we're having trouble with our live feed. It disconnected. So we'll just take a short break. We're back on. The volume's good. Okay, is everyone ready? Yeah. I'm going to open up the room. Okay, thank you. We could reconvene this. Let's just go back to where we were. Last in the queue was MLA Jacobson, and he had one follow-up that he could ask. And so, MLA Jacobson, go ahead.
Thank you, Mr. Chair. Thank you, Mr. Kandola, for that, Dr. Kandola, for that response. Now I got a whole different one. I have one on our, every time something happens, our youth are forgotten in regards to what's happening, especially in my small communities that I represent in the Nut. But what are we doing for them? We have winter coming, going to set in. We still have the sanction, I guess, for 25 people for gatherings and stuff like that. What are we doing for our youth? Are we going to give them more free internet? Are we going to give them iPads or computers? And this is not only the youth, this is for everybody in the small communities. Because us, it's where we're from, it's wintertime, it's dark and cold. We tend to stay in, work during the day, come home, and it's just, it's really tough. I mean, I really am worrying about my youth. I don't, when people are idle, the alcohol comes out and all that stuff that comes out, and we need help for the small communities, the small outlying communities. We don't have nothing that's going on like restaurants and stuff like that. And how do we help the small communities in regards to giving them, like, do we give them, like what I said, do we give them computers? Do we give them free internet access for the winter? What can we do for them, Madam Premier? I'm really, I'm asking for help. Thank you.
Thank you, Emily Jacobson. Madam Premier.
Thank you, Mr. Chair. I hear the MLA, and I know it must be tough for young people in the territories at the ages when they should be socializing and meeting new friends is the time we're telling them lock down and be careful who you meet. I know that within the education system, we are trying to do things so that we can address the needs, such as giving out computers, etc., technology to assist students, and hopefully most will be covered within that. I think the other thing that we need to do, I mean, there's still programs that support youth within the government. Those programs will hopefully still go forward. But a big thing, and that's right across the board, is that people have been saying we need to bump up our communications. And part of the Secretariat, part of that $2.7 million that we talk about is for a communications team to actually be able to do that. And communicating just to the public, and if we neglect to communicate to our youth, to try to address some of their concerns, to try to give them the answer to the questions that they have personally, then in my opinion, Mr. Chair, then we're not doing our job as well. So I will make a commitment that as we go forward, if we can get a communications part to this Secretariat instead of trying to do it on the side of the desk, then we will actually look at a campaign for our youth as well. Thank you, Mr. Chair.
Thank you, Madam Premier. Up next, I have Emily Simpson. The floor is yours.
Thank you, Mr. Chair. I guess I'd like to start with costs, because I guess what I'm hearing from constituents in Hay River is the issue of the cost of this approach that we're taking with the Secretariat. So I think when I look at it, I think I have an understanding of what's happening, but I think you as Premier have to do a better job of explaining to the people of the NWT what the cost will be based on moving from our current approach to that of establishing the Secretariat. Because I think what people are seeing is that, you know, we had 163 people working with respect to COVID, and now we're looking at 150. So I think they're saying, well, geez, you know, so those 163 are going back to their departments. And now we've got to go out and hire 150 new people. And I even heard that you know, some people were saying, well, geez, I heard that the people are all coming in from Alberta or from southern Canada to take up these positions. So those are the kind of rumors that are flying around out there, and people just aren't hearing enough from this government on exactly what's happening. Because I guess when I look at it, I see that we had 163 people working, and when they were working on COVID activities, did that mean that the money from their department follow them and pay those costs? And now that they're going back, we lose that money and we have to find new dollars to replace them. And if that's so, then that kind of that 2 million plus, you know, doesn't really hold water. I would suspect it would be more, and I think that's what people are looking at. And then they see 80 plus million in 3 years, and that's scary when, you know, people are just trying to put food on their table right now and keep their businesses afloat and so on. So I think that, you know, we need a strategy. We need to get the information out there. We have to make sure it's clear so people actually know. Again, I guess with staffing, you know, I want to make sure that, you know, with respect to staffing, that we are looking at hiring residents from NWT, and you know, and try and limit, you know, the number of people we have to bring in, if, you know, and hopefully we don't have to bring in anybody from down south. And I think people need to know that. So that's another area there. The other thing is, you know, by establishing the Secretariat versus our current approach, how is that actually going to translate into efficient 811 and protect NWT services and increase response times to people's questions as well? And how is it going to result into timely enforcement, I guess, on the ground in the communities? Because that's always, you know, that's another big concern I hear. And the other thing is the misuse of that I hear of self-isolation centers, and, you know, people going south, coming back, and, you know, just kind of using it as a way to, you know, to live. And so we've got to, so those are all the things that people are looking at, and they're not hearing any information from this government and how we're addressing it. And I think we have to do that. I've always been under the belief that we need a coordinated approach, and whether we call it a secretariat or whatever we want to call it, I don't really care. But I know we need a coordinated approach, but we have to be able to, let the residents of the NWT know that what we're doing is cost effective, that we're also trying to get as much money back from the federal government as we can. And, so that's the approach. So we've got to just make sure that they're aware, because we can't go on, keeping them in the dark on this. Another area that I'd like to talk about is the borders, and the staff there do a great job. Like I came to the border after going to Calgary, and when I came across, and I stopped, and they asked me for ID, and I told them I didn't have any. I said I lost it, and I wanted to see what they would do. And they said, well, you can't really go. And I said, well, I'm from here, lived here 64 years, and I'm going. And then the one lady said, well, actually I know you, so I can vouch for you. So that was good. So then I showed her my ID. But I just want to test the system. But, they do a good job. They've got limited resources out there. And now I understand that they are setting up a camp at the border in Highway 1. But the camp is a tent-style camp with heaters, Toyo heaters or something that, that they've got to fuel every day, and, they don't have proper toilet facilities. And it's more of I understand it's more of a camp that you run into a mining setting before you actually bring in the main new fancy camp in, right? So my understanding is that these people were going to get something that was workable, and that they could live in and be comfortable. Because if they're out there all winter, you want to keep them out. Like, you want them to go back. And if this situation is if what I'm hearing is true, you're going to have one hell of a time trying to keep people out there working. So I think you should take a look at it. And communications out there as well. That's another big issue, not only for the staff, but also for the people that are coming up to the border as well. And the other thing that I found interesting is that my understanding is that the people working there, the staff working there, are not tested at all. And being the front line, I guess, defense here, that I would suspect that at least once in a while they would actually be run through some testing, because they come back into town every 4 days or whatever it is, and they're out and about around town. So we don't know. We don't know if they've got something, then they don't know. So I think that's important to look at that as well. But I think at the end of the day, I want to see better communication between this government and the residents of the NWT. It's got to be clear and concise, and like I go through the COVID website and different documents in that, and again, that's confusing. Like, when I came across, I was supposed to do, I think, the 2-day, 4-day, or 6-day, and report in, and and they sent me something, and they said, but don't click on this. You can go and find it. Well, I tried to find it, I couldn't, and finally I just emailed back and said, I can't find it. Just send it to me. So they did, and we've got to make it easy for people. We don't want people to have to really think about it, because then that's when they get mad, and they let us know that. And we're here to provide a service. We're here to keep them safe. And I think we've done one hell of a job doing that, and I'm glad. So there's a number of things that I commented on, but I think that the people want to know what's the actual cost of this to the GNWT, and at the end of the day, are we how much are we actually going to bear with respect to this new secretariat? Thank you, Mr. Chair.
Thank you, Emily Simpson. I heard a few questions there. Maybe we could start with Madam Premier. Madam Premier, go ahead.
Thank you, Mr. Chair. Quite a few questions there, MLA Simpson. Absolutely, I agree. Communication has been a huge deficit since we had the outbreak of COVID-19, the pandemic arise. We've been trying to operate. Communication has been a problem across the GNWT for many, many years. However, as the finance minister spoke, because we were always close to the borrowing limit, because we always had so many priorities and so many things that we had to keep going, I personally think that communications didn't get the attention it needed. So again, within this COVID Secretariat, if we can get this, if we get agreement on this, then we do have a communications team. Their whole thing, it won't be off the side of the desk. It will be actually looking at our communications, making sure they're clear, concise, and getting out to the residents. Right now, communications are happening off the side of every department's desk. In fact, even ministers, we don't even have a communications person allocated to us individually. So we're all sharing, we're all trying to do our best. It's a huge deficit for the GNWT, so hopefully we can get the support to actually get more communications in. As for the staffing, I mean, there's things to take into consideration, kind of get you that information, but we can either keep it as it's going, which I'm hearing people are wanting, and I'm open to that, but we also have to think about things like, I went to the board of, to the airports, and I talked to the staff there, and they were so committed. It was incredible. They were giving 7 days a week, 16, 18 hours a day, because they were trying to do the shifts at the border patrols, and then they were trying to do their normal work off the side of their desk so that things wouldn't fall off the side. They talked about they couldn't keep it up. So we're losing people if we keep trying to work them to the bone. There's reasons those positions were in place with the government to start with. So we can't just say, now you're going to do this COVID Secretariat or this work for the long term and then expect you to still do the jobs that you need to do. As for the staffing, absolutely none of these positions should come from the north or from the south. I don't see the need for it. I confirmed with Russ, and he's in agreement as well. These jobs will be from the north. They're about supporting northern residents, and who best to know how to support ourselves than ourselves. The 811 and the Protect NWT, again, that is why we need this sustainability of a secretariat. We can't keep up with the capacity. We don't have enough staff in there. We don't have the resources we need. If we keep doing it off the side of our desk like now, we're in trouble. So we've got kind of a minimum staffing, and the workload is too high. So we do need to staff that better and have money put in there. And again, the Secretariat having it coordinated under one will better result in more faster response time and more efficient services in our task force, in our NWT, in all of the areas. As for the self-isolation centers and people misusing it, with any system and any program, there's always a certain percentage of the population that misuse programs. But the percentage in the stats that we've been compiling is very, very marginal. It's not the norm. Most people actually do not appreciate being in an isolation center for 14 days. It might sound fun for the first day or two, but after it becomes very tiresome quickly is what I'm hearing. The borders, again, it's something we need to look at. We are working with one of the mines to actually put in structures in there. Again, I'm a little bit rough. My father was a diamond driller. Many people lived in those wall tents for the whole of winters back in the day. So, but I hear you. I'm open to suggestions and how we can do better. But again, if we don't have extra money for these things, that won't be happening. If it's status quo, it's going to be like boring what we can to make things happen. I think the last question was really around the testing units, Mr. Chair, with your permission, then I think we should turn that over to Dr. Kandola on that question. Thank you.
Dr. Kandola.
So I think that the best line of defense for border patrol will be to be physically distancing washing their hands, wearing a mask if they can. Typically, if we had picked up a COVID positive case, we would have looked back at contact tracing, and if there was, if that person arrived by road or airport and there was an exposure, we would then test or isolate anyone who would have been at risk for exposure. But for that particular category of people who are in that type of allowing people coming in and out of territory, the best line of defense is always maintain 6 feet apart, wear a mask, wash your hands often, don't touch your eyes, nose, and face. So that's the best approach for them. The actual, if we were to do testing, it would be people who would have a risk or people who have signs and symptoms of COVID would be the top priority to get tested. And then the whole approach moving forward of a game changer is to have the approval of a testing ability that doesn't require a specialized lab, that can be done quickly, that can be done relatively cheaply. That would be a game changer and would allow us to do more targeted screening for people, especially those coming out of territory.
Thank you, Dr. Kandola. Okay, up next I have MLA O'Reilly. Oh, sorry, did you want to follow up? Okay, no, I thought you were good. My apologies. MLA Simpson, go ahead.
Thank you, Mr. Chair. One other concern I have is in what Minister Green had mentioned is the established safe isolation spaces for street-involved individuals. And I just want to talk about Hay River is that we do have a place for people who are living on the street, but it's only from 6 o'clock at night till 8 o'clock in the morning, and then after that, you know, they've got to be back on the street again. And we are getting into winter, and we have to address that. So I think what it's going to take in Hay River is extra dollars to ensure that staff can be hired to work with the people during the day. And I'm just looking for, you know, some type of commitment, I guess, from the minister that that'll be consideration for Hay River. We're talking maybe a dozen people, 10 to a dozen people. So, and I'm not sure what the cost would be, but I think it's important because otherwise, you know, they're going to be on the street, and when you're on the street, and in the time of COVID here, that one of the, you know, you don't have access to basic infrastructure like washrooms and that. You can't really go anywhere. Everybody's got everything locked up. It seems like it. So, and I talk to the guys on the street all the time, and and those are some of the issues, and just getting food as well. So I think that's an area that we really got to put some thought into and act on quickly. So I'd just like to maybe hear comment from Minister Green on that. Thank you, Mr. Chair.
Thank you, Emily Simpson. Minister Green.
Yeah, thank you very much for the question, Mr. Simpson. And I understand that this is a need in hub communities and in Yellowknife as well. That there is some respite for people who are outdoors all day, especially as it comes to winter. We've been working very hard in Yellowknife, where the biggest at-risk population lives. But the idea of using the new Hay River homeless shelter as a day shelter as well, I think is an idea that has a lot of merit. And I think that there are other places in the NWT, in Inuvik, in Fort Smith, where there are street populations, for us to look at how we can support those people through the winter. And so I certainly do commit to investigating that and coming back with something more substantive for you.
Thank you, Minister Green. Okay, up next I have MLA O'Reilly. O'Reilly, the line is yours.
Mr. O'Reilly, can you please unmute? Thanks, Mr. Chair. I'd like to take a page out of MLA Simpson's book and relate a personal story about border controls, if I can. Then I want to ask a question about the COVID Secretariat. So this past summer, my wife and I, we had a 7,000-kilometer road trip. We ended up in Edmonton. We came back across the border south of Enterprise. And when we came across, I was under the impression, having read websites and so on, that we only needed one self-isolation plan. So when we came across, we had one self-isolation plan. It was for myself. I thought it covered my wife. It didn't, as I found out later. But nobody ever contacted her about this. And then when she did actually go ahead and file her own self-isolation plan, but we got the first couple of emails with the self-assessment checks, the checklist. We filled those out, and then all of a sudden they stopped coming. Nothing. So I called 811, took 2 times to actually get through to a human being. And then I was told that our files had been inactivated for some reason. So we could have gone on and not done anything about it, but we did finish the checklists and so on. So I just relay that as a couple of little glitches that probably shouldn't be happening, but, you know, I could have had COVID and slipped through. And then last month, we went to Inuvik for one of our standing committee meetings. We landed so I get on the plane. Clearly, the guy sitting next to me is not from the Northwest Territories. I have to sit next to this individual. Yes, we're both wearing masks all the way up to Inuvik. We get off in Inuvik, and they have very strict border controls at the airport in Inuvik, and I want to give them lots of credit. You get off, you have to answer questions about and show them ID, who you are, who you work for, where you're going, how you're going to get there, where you're staying, how long you're going to stay there. That's the kind of information I expect to see collected. That's not what happened when I came in across the border south of Enterprise. So anyways, I think we need to find a way to clear up these inconsistencies around the border control. Mr. Chair, I want to move on to the COVID Secretariat, and I want to support what my colleague from Hay River said about the poor communications around this. I think the poor communications have resulted in a large public backlash, particularly from the business community. And I think I appreciate what the Premier has said tonight to start to hopefully clarify this. I support the idea of a COVID Secretariat. I support the funding because we're already doing these things now. So I am prepared to support it. I'm not prepared to cut 811. I'm not prepared to cut the self-isolation centers. I'm not prepared to cut the enforcement border control activities, which is what the $86 million will actually cover. It's over 2.5 years. So, but we have to be very, very clear with the communications around that. The issue, though, that I want to raise is around the staffing of the positions, because most of those people filling them now are redeployed from their home departments. So are these going to be term positions? And what kind of job security will people have with those term positions if there's an early end to the pandemic? Will they be able to go back to their home departments? What about the people that will have backfilled those positions in the home departments? What kind of job security do they have? So it's all a question of fairness and how we're going to staff this. So I guess I'd like to have some clarity and certainty around how we're going to try to fill these positions to be fair to everybody involved, and how we're going to deal with the issue of perhaps an early end to the pandemic, because I think what you've given us is a worst case scenario. Thanks, Mr. Chair.
Thank you, Emily O'Reilly. Who would like to take that? Madam Premier?
Thank you, Mr. Chair. I'll start with the Border Patrols. Thank you for recognizing that Inuvik has strong patrols. I know that Yellowknife Airport as well has some of that. That is what the Secretariat's about, is to making sure that all of the services right across are coordinated, that we don't have one different set of rules at border crossing, that's road crossing, versus what we're doing at the airport. So again, that is one of the problems that we were seeing, is that when different departments had controls over different aspects of it, not everybody was on the same page, because everybody was doing what they needed to do to address the issues that they were responsible for. So the Secretariat should, in a better, make sure that those things are more more standard across the services that we provide. Communications, absolutely. Again, I do take ownership for that. There's no saying if you could turn back time, but we can't turn back time. So what we've done about it is we recognize that we didn't do a good job of putting out the Secretariat to the public. I was kind of hoping we'd have a little bit more time with MLAs to brainstorm and stuff. Didn't go that way, but that's how life goes. So what we've done, though, is we're trying to, again, reach out to you today, AOC, explain some of the things. We are reaching out to the media, doing more technical briefings with them, and we are going to try to beef up the communication so people understand that it's not just extra money on top. It's actually 3/4 of it is actually providing the services we already have now, and bumping those up so they're better services. I should note also, as well, as not all this money is just coming from the GNWT. For sure, a portion of it is, but the federal government recognizes COVID-19 as an issue across Canada. They've started with the Safe Restart monies that they've given us. They're also coming out with the Northern Package, and they've committed to actually looking further at supporting the Northern Territories as we move forward with this. So some of that money will go to the Secretariat, to the areas that we've identified, but also some of it is going to go to our healthcare services and other entities within that that we've been negotiating at the federal table, such as airlines, community governments, etc. As for staffing, yes. So the positions that will be filled, if accepted by in the House, will be filled by term positions, and they'll be guaranteed if they're full-time within the department. They'll actually have positions as they move back into once COVID-19 is addressed. And the ones that are in positions that might need some backfilling, some of those will be left vacant if we can, because we're conscious that the money is tight. And other ones, they would also be hired on a term position as well. So our commitment is to make sure that the people that are committed, that have done the public service servants that have stepped up and that gone above and beyond, will have the opportunity to keep doing that, and that they will be guaranteed that they have positions when this is addressed. Thank you, Mr. Chair.
Thank you, Madam Premier. Emily Riley, follow-up question?
Thanks. Yeah, I want to turn to the targeted screening program. I've heard from one constituent family who one of the parents works on a rotation in Fort McMurray. They have to come back and self-isolate for 2 weeks and then off to work again. And it's creating a tremendous strain on that family. And I understand that there's others in the same situation here in Yellowknife. I've heard from individuals who have to go for regular cancer treatment down to Edmonton, and they spend most of their life in self-isolation. That's just not a healthy thing to have happen. So I guess I just want to have a better understanding of when we're going to be in a position to have targeted screening to help out these kinds of situations, and when we're actually going to develop the criteria priority list for who's going to be eligible for the targeted screening program, because that's not out there. So I'd like to get a clear idea of when we're going to be there, a timeline for it, and how the priorities are going to be set for a targeted screening program. So that's probably a question for the medical folks, but thanks, Mr. Chair.
Thank you, Emily O'Reilly. That sounds like a question for Dr. Kandola. Would you like to take that?
Thank you for the question. We're all eagerly anticipating the ability to do targeted screening. And when we look at our priority right now, the priority is rapid testing for symptomatic people and being able to provide that service as much as possible within NWT. We still need to ramp up on that capability, but we will get there. The next priority would be then using targeted screening to for people, such as the scenario you talked, specifically people coming in, having to self-isolate for 14 days, and using modeling to decide when you target screening, when is the best point where you can do targeted screening and you can safely shorten the isolation period, or how do we use targeted screening to allow essential service workers to go into small communities. These are all considerations. But what we do know is if we put when we look at the amount of people coming into the territory, it hasn't gone down. It's about 855 from last week. The highest was around 1,200, but people are continuing to come in. And so at the minimum, we need the ability to do targeted screening for at least 1,000 people a week. With that, our biggest limitation is that if we're going to take this approach, we need to use a diagnostic test that is not going to require specialized lab capacity or specialized health resources. We need to have ability. How are we going to deliver this? How can we test people in a timely way and then deliver the results? So those are all the options that we're exploring. But the final, most rate-limited step is there is a particular point-of-care test that meets this criteria that's ideal, but is being reviewed by Health Canada, and they have to give their check. They have to say, yes, this is Health Canada approved. It's regulated within Canada. Then we can then offer that. At this point, there is no point-of-care test that is approved by Health Canada, and there's one underway, hopefully in the next few weeks. Once it's approved, I can move forward and start assessing how we would provide targeted screening, not only for the cases that you talk about, but other cases as well. Thank you.
Thank you, Dr. Kandola. Up next, I have Emily Martselos. Floor is yours.
Thank you, Mr. Chair. First of all, I want to thank the Premier, the Cabinet, and the healthcare people that are around the table with us tonight, trying to fill the gap of lack of information to the communities and to the regional centers. I have to remind everybody that we have 0 cases, okay? It is extremely important that basic health cares at regional centers and small communities are addressed. I know with my community, I've asked many people ever since we got this costing summary on August the 1st, with the whole, with the secretariat that's already in place, that's already in lease space, that's already spending the money that is in the cost summary, and the supplement still hasn't been approved by members in the House. You know, people have to realize that there are certain processes that everybody is expected to follow when you're using public monies. And I'm saying that because this is public money, and another layer of bureaucracy is not always the right thing to do. We know we need a coordinated approach, and we support you on that, Madam Premier. We know that. Whether you call it a secretariat or something else, it doesn't really matter. But the amount of people that is required for the amount of people we're serving with 0 cases is questionable. My community wants the borders to remain closed. They want basic health measures reinstated in Fort Smith. They want to remain safe They want to ensure that all safety PE equipment is available, including ventilators. They would like rapid testing, readily available. And I agree with MLA Johnson that the quarantine period could be shortened if we had it done properly. We have to be treated like anyone else in the territories, especially the way things are rolled out in the capital. That has always been a lacking part of this whole central government thing. And, you know, I just want to make sure that we have balance. Balance is so important. And when we talk about our borders, I think that they have to have proper units in place with the rapid testing right at the borders and the airports. And so that we are safe. And I know we are safe, and I'm very happy that I'm very thankful to all the essential workers, from the nurses to the doctors to the healthcare workers and all the essential workers that have put all that extra time in keeping us safe. We are very fortunate to be saying that we have 0 cases. The pandemic is scary, and we all know that. But we also don't want to do things so that we just do it for a reason of overspending budgets and overspending things, because that's not the way we're going to bring back the economy. The business and the economy and what we're doing, there has to be a balance. I think some of the monies that we have put forward in this costing summary should be going to bringing back the economy. No one around the table has talked about what's happening out there in our communities, in the regional centers, and even here in Yellowknife. You know, there's a lot of places that are not fully opened. And you have to think about those things. It's the business community that really helps everybody in Canada, within the communities, within the cities, within the communities. The economy is extremely important. And the business community is hurting. With all these, where there's too many, we're in a bubble. And I find that within the communities and within anywhere in the territories, because we're in a bubble with 0 cases, we're not stimulating the economy. We can't only stimulate what we do in government. Majority of the government is here, and a lot of the people, because of the way things are with this emerging wisely, a lot of people are not even going out to the restaurants. You go to the restaurants and most of them are empty. And that is very, you look at the whole thing from an objective point of view, you have to realize that there is a balance. I'm not saying to you, Madam Premier, that we can't have a coordinated approach. You know that you have to have that in order to keep us safe. I believe that rapid testing is one of the solutions. I want to make sure that the borders have the ability to do what they're supposed to be doing. And if we have to do the testing at the borders, you see it all over the country. Everybody's getting testing in lines and things. Many of us haven't even been tested. And because we live in the communities. Just the process has to be what we have here in the capital. Many of us in the communities and regional centers are very envious of. It's always about what we have to do here. And it's not being against the capital. It's about sharing. sharing to make sure that everybody has the same opportunity throughout the territories. That's what it's all about. And making sure that each and every person in this territory has the same right as anybody that lives in the capital. And that's not saying that I'm against anything that we do here in the capital, because what we do here is an example to make sure that everybody else benefits. One of the things I want to talk about is to make sure that when we get a vaccine, that this department, I asked this question twice now, never got an answer, that once we get a vaccine and a vaccine is implemented, this department will be nil and null. And I've never got an answer directly. So I'm asking that same question again tonight. I'm asking also to ensure that public monies are spent reasonably. I'm not saying that you have to close your office that is already opened. I'm not saying that you have to do things in a different manner. But you know what? We have to follow a process when we're spending public monies. And, that's questionable here because you don't do all these things and come back and ask us for a supplement in October. Because, you have to convince me as an MLA that that is the right thing. I'm used to standing alone. I've said that before. And I will if I have to. Because I'm very much about accountability and transparency and open government. I practiced that even in my other leadership at a First Nation for over a decade. And it was very successful. And sure, you'll have people that would criticize, but when you know you're doing the right thing and you're doing it for the right reasons, then it's okay. And I know your heart is in the right place, Madam Premier. You want to keep us safe. I know you want to do the best for the people of the Northwest Territories. Sometimes you got to make some little changes to communicate that, to ensure that that your message is clear. And I know I've said a lot of things tonight, but I know that we also have to make sure that the management of those isolation centers have a certain criteria. Some people are using it as a place where they come back to isolate and just to, it's almost like a holiday. And I think that with rapid testing, if we could eventually get rid of the isolation centers and re-look at your whole criteria about your core group that you're going to have within your secretariat, because it's already established. And also balance it with the economy and some of the concerns of the business community, because it is a big concern. I don't want to see any small business, medium business, or large business close because we have closed borders. But at this time, with what's happening down south, it is scary. We know that Ontario, Quebec, and some of the larger areas that are very populated are going through a second wave. Some of them have declared that. Look at Europe. Europe is scary. And I want to make sure that all the people in the Northwest Territories are safe, because I think it's extremely important that we keep our people safe, and I know you want that too. but doing things just a little bit differently, making sure the communication is there, making sure that our regional centers and our small communities are able to deal with a case if it happens in their area is important. You know, not everybody wants to come to Yellowknife. I know Stanton is the main area, and you know, and it could happen here. We might have, there might be a break. You never know.
Mr. Chair, this is Rylan Johnson here. This has been 10 minutes. Please bring some order to this meeting. Thank you.
Emily Johnson, you've had your opportunity to speak, and we'll let Emily Marcelo finish what she's doing. Thank you.
Well, with that, Madam Premier, I want to thank you for tonight. I want to acknowledge Minister Green in her new position, because I know her heart is also in this in a positive way. And I don't have to be reminded by MLA Johnson. Okay, once you've come to my age, I get the time to speak as long as I want. And so he's got 30 more years to wait, or 35 more years to wait to be able to do that. And I don't need to be reminded by someone that young. Thank you so much, Mr. Chair.
Let's show Emily Marcelos, Madam Premier.
Thank you, Mr. Chair. Thank you, Emily Marcelos, for your comments. I sincerely thank you for recognizing that we do need a coordinated approach. I think that all MLAs knew that there were some issues. We got COVID-19 came to us at the end of the spring session, if I remember right, and now we're going into our next session, our next regular session. So that did make some issues. Ideally, we'd be meeting more in sessions, and then we'd be able to pass more things through MLAs. But it's the process of the sittings and stuff that make things tough. And I think we had to make a decision based on the health and safety of people. So ideally, would have done it totally different. But the reality that we were faced in, we had to make some really tough decisions, like you said. Sometimes we have to make those decisions and stand by them. The amount of cases, 0 cases, and you're absolutely right. However, it's important to note, and I think that Dr. Kandola has done a really good job of trying to stress that this evening and throughout her time speaking to the public, that it's the jurisdictions, the 7 jurisdictions that have tight controls. Those are the ones with 0 cases. The ones that don't have the tight controls, that don't have the border controls, that don't have the isolations, there's combined thousands a day. So that's huge, and so it says something. It's not just luck that 7 jurisdictions that have tight controls have 0 cases. And again, to try to find out how many we've prevented is kind of hard, because when you're saying you can't come unless you've got an employment or you live here, it makes it really tough to find out how many we've backed off. How many, if we didn't have those tight controls, if we would have had how many cases and the instance of community spread. So, recognizing again, thank you, that the status quo isn't sustainable. You know, again, it's talking about staff burnout. It's talking about the cost of overtime. People are trying to do 2 jobs at the same time. So is that a better use of our funding, or is it better use of our funding instead of having one person working 16 hours and burning out? Is it better to have 2 people, so 2 families have options to actually have an income, especially when the economy is bad? But you're right, we need to have a balance. We need to balance between our businesses and our healthcare, and we've been trying to support our businesses as much as possible. I'm not sure, Mr. Chair, if Minister of ITI would like to speak more on that, but and finance. But we have a lot of relief packages that we've implemented for the GNWT to support our businesses. Many our revenues were cut because of trying to support our businesses, and we've been working closely with the federal government as well to make sure that our programs complement theirs and try not to duplicate as well. I'll leave the border and the rapid testing. I'm not sure if Dr. Kandola would want to talk on that, but the the isolation center criteria, absolutely, that is a reason that we're talking about having a coordinated response so that things have standards across. And I think that, both Dr. Kandola and myself have talked about, we need to alleviate some of those costs of isolation units, but it's a matter of making sure that we have the structures in place so that residents are still safe before we can do that. Balancing in communities, Yellowknife and the other communities, absolutely, that's a priority of this government right across, and it's something that we need to do all the time. So within this proposed secretariat, because again, I'm conscious that it has to come through the House, is that 44% of those positions are actually not in Yellowknife. They're actually from the communities and regional centres. And like I said, we're not looking to hire anyone from the South for these positions. So those are 44% of the positions are going to be northern people from the regions and the smaller communities. And if we can hire more, then we will do that. The vaccines, absolutely. I know you said you've been asking that question and you haven't got a straight answer. I'll give you a straight answer. Absolutely. If we can get vaccinations throughout in Canada and we can get our people treated, and Dr. Kandola says we're at a place that the risk is really low, we should be okay, I would be more than glad to dissolve this secretariat. We have huge mandates. We have huge program delivery responsibilities that we could absolutely use our resources and our funding for more effectively. But again, it was the choice of making a decision, programming, niceties, or the health and safety of people. And I have to back up Dr. Kandola for making the choice and saying health and safety is first. And all of Canada has made that choice. The whole world is making that choice, in fact. Again, thank you for bringing up that communications. We need to make sure our messaging is clear. That is part of this the structure, the 10 extra positions that we're not going to need that aren't isolation or border patrols or A11 or the Protect NWT. Part of that is the communications team, and because we recognize we need to bump it up. The people want more. We need to be clearer in our messaging. And like I said, in my opinion, I think we sacrifice communications throughout other governments to be able to provide the level of programming we did in our financial situations. But we can't afford that anymore. We need to have proper communications for this throughout this pandemic so that people have the assurances that they need. And again, thank you for your comments. I'm more than open to feedback. If any of the MLAs want to send me emails and give me ideas on how they think we can be more effective, more efficient, then please send them. Again, though, we don't have a lot of time. The second wave is among us, not in the territories, but it's in southern Canada. Even our Prime Minister announced that yesterday, right after the speech from the throne, in fact. That's how serious it is. So we don't have a lot of time, but I'm more than willing to work with MLAs and take some suggestions and see if we can make this more efficient and more effective as we go forward. Thank you, Mr. Chair.
Thank you, Madam Premier. We're coming up at 9:15 right now. I did have a quick question myself and a quick comment. So, Minister Green said something earlier about evidence-based path, and I think that, I couldn't agree more, Minister Green, but the path that we're taking right now with this COVID Secretariat isn't, I really feel isn't the way, from what I've heard tonight. There's a lot of people in our communities are still hurting. And again, we've heard a huge upward from our business community, and we need to hear them. We need to listen to them. I really believe there is a better way to do this. And that's my take on it. Right now, to sign off on an $86 million supplementary appropriation right now in its current form, I can't do it. I just couldn't bring myself to do that right now. I couldn't support that right now to do this if you put me on that spot right now. So that's my position as on that. Those are my thoughts. I did have a quick question for Dr. Kandola. Right now we're doing 14 days isolation, and I'm looking at ways to try to reduce costs for our public monies. Is there any way we could lower this self-isolation time from 14 days to 10 days. And the reason I'm asking that, I did ask a physician earlier about this, and he said you could probably get away with getting away with self-isolation for 10 days. Is there any truth to that? Do you think we could actually reduce our self-isolation times to 10 days, Dr. Kandola?
Across Canada, they're all doing 14 days. But what we've been modeling the 10 days, and we've looked at other jurisdictions like the Netherlands that have done the 10 days. And so with the modeling at 10 days, most people become symptomatic with the COVID virus in the first 5 to 7 days. By day 10, from what we looked at, 94% would have been symptomatic. Our approach about if we were to shorten the isolation from 14 to 10, we would, the best and most secure approach in discontinuing that would be to offer that rapid antigen test on day 10, and if it's negative, then just shorten it to 10 days versus just saying 10 days and then for the remaining 6% wait it out. I think that was where we were going with modeling around having a quick, effective test available. Would be day 10 would be ideal to apply the test, and if it's negative, to discontinue isolation at day 10. Any earlier, you start to get more and more the risk of missing people who later become symptomatic. The one thing about this antigen test is it's not a replacement. The highest yield of any test will be when people are symptomatic. But sometimes with the rapid antigen test, which is different from the more sensitive test we're doing for the right now, is that if you have a negative, it could be a false negative. So ideally, with the modeling, you want to apply that test later on, like at 10 days when you anticipate most people who had symptoms would have presented. What that means is, from when I'm listening to people, it seems like they feel like if on day 1 you took that test, you don't have to do the 14-day isolation, and that is incorrect. That you a test at day 1 doesn't replace 14 days isolation, but a test at day 10, when what you model is that 94% of people would have been symptomatic at that point, and a test at day 10 would be ideal to shorten the isolation period. What the test at day 1 does, is give people more options. So let's suppose people are coming in and they test at day 1, and they could have the option to isolate in the communities, because what we want to do is screen as much people, just like with the mine, screen as much people coming in, and if they do have COVID, and if they're in the regional hubs, better that they isolate there as much as possible. And so that would be one way to reduce the risk, but it doesn't replace isolation if you do it at day 1.
Okay, Dr. Kandola. And with that, I think we're at the bottom of our list here. Just give me a moment here. And with that, I think that would conclude our public portion of this meeting. And I want to thank everybody for all their hard work. And thank you, Premier Cochrane, Minister Green, and Dr. Kandola. And with that, thank you. Do I have a motion to go to camera? Sorry, in camera. My apologies. In camera. Yeah, I have Emily Simpson. I don't see any objections. We are now in camera.